Across the U.S., almost 700,000 children and teens have tested positive for COVID-19. A report from the American Academy of Pediatrics and the Children's Hospital Association shows the youth of Arizona are some of the most affected. Cronkite News reporter Harry Croton learned about the struggle many are facing in the valley.
About a month ago, baby Jay contracted a fever that at one point reached 103 degrees. His parents had also felt ill, but not to that extent.
Mine went away like within 24 hours. So I didn't think, and it was a mild fever, so I didn't think too much of it. But his kept going for, I think, about 4 days, 3 or 4 days.
Katie GIPSON-MCLEAN and her husband REESE didn't initially think COVID-19 was to blame for their mild symptoms, but they got tested anyway and learned they both had the virus.
Once his test came back positive, I set up a rapid test and I called Jay's pediatrician back, and they said that they would like Jay to get tested at that point.
Children and youth account for close to 11% of all COVID cases across the U.S., but some 14% of positive cases in Arizona. A lack of specific data from all 50 states, as well as lower testing rates among youth, suggests that number may be even higher.
The data that we have so far is not the whole picture. So we know that, there's definitely more in the community.
Another factor could be that some 59% of Arizonans 19 or younger are children of color, and research shows these youth are more likely to have health problems that put them in danger of contracting COVID. The Centers for Disease Control and Prevention reports that Hispanic youth with the virus have been hospitalized 3 times as frequently as whites. Black youth have been hospitalized twice as often.
Because of underlying structural inequalities in our society, some people are going to be at greater risk of being exposed to a virus like this than others.
If children and teenagers do get the virus, data shows that they're less likely than adults to get sick. But Dr. Wasim Balan at Phoenix Children's emphasizes the importance of remaining prepared and remaining cautious. Wash your hands, social distance, and always keep a packet of masks handy.
Those are the 3 things that are proven to, help limit the spread of the virus, and we should continue operate with those recommendations in mind for the foreseeable future.
After hunting for places that would test an 8-month-old, Jay's mother finally took him to a Banner Health site at the Arizona Fairgrounds. He received a swab test, which came back negative, but Jay's mom thinks the test wasn't done properly.
She was scared about, I think, putting the swab in too far or how long she was going to be able to do it for. She didn't want to hurt him.
The family quarantined together for a few weeks and have since recovered. But even as life returns to normal, Katie and Reese say they wish there were more resources available for parents who may experience what they did. Harry Croton, Cronkite News.
The National Academies of Science, Engineering, and Medicine released plans this month for allocation of a COVID vaccine once it's available. Children will be part of phase 3 of distribution behind healthcare workers, the elderly, and those with underlying health risks.